Let's say we've done that first variation and it's getting a bit easy. Patient's doing it and they want to progress it. We're going to move on to this exercise here now. So if I can get you over here, we're going to do the same curtsy type lunge. The left side is still the one that we're focusing on. So this is still our affected leg, okay? But now we're going to be going through a greater degree of range of movement. But we're going to break it down so we can control it. So what we're going to get the patient to do with this right leg is take the slider to the opposite corner on the block or on the slide block. You go all the way down right to the corner and then back to start. And you can see when he starts to do that, when he starts to reach further, we have more trunk flexion and we actually have more load going through that compressive component here on that lateral hip as he starts to do it. So we're starting to focus on that principle that we discussed. In order to add a level of variation, what we'll get the patient to do is go directly back as well. So you can do a front stretch or kind of a rear type lunge stretch, come back up, and equally add in a complete lateral slide. So to start with, I would probably say come out to the side and then back up. And if that's too easy with the side version of it, move over. If you just kind of take your left foot and move over and maybe plant it here. Perfect. And then with the right foot, reach over to this side. So come right across, big stretch, and you can see that adduction, that compressive load that we'll be putting through the hip, and then vary it back to the back corner again as well. Now this is a quite challenging exercise. Your patient needs to be able to build up to get to be able to do this, but if they can, it's a great exercise to have in your arsenal of what you're choosing. Now, if you're following these principles of trying to add in this kind of load, we're going to go through a third version of something similar to this over here. So if I can get you to stand over here and balance, and we'll use the same leg as the one which is causing the issue. So we're going to say balance on your left leg, hold the weight in the opposite hand, and what we want the patient to do with the right hand is reach towards the opposite corner of the box. So nice and controlled down to there and then back up. But the difference here is now we're starting to work on some load. We've got a 5 kilogram dumbbell in his hand where we're starting to add in a bit more load to make that level of difficulty higher. We're starting to work through that same range of movement similar to the curtsy lunge, but with a bit more force and a bit more weight, I should say, in the hand. But what we want to have a look for here isn't just pain, but is also the control of how he's doing the exercise, which as you can see, he's doing perfectly.